All right, good evening, everyone. Welcome in. If you wouldn't mind selecting an option from the poll, that would be great as we get started here. My name is Adam, and I will be your moderator. Tonight, we're joined by Dr. Robin Henderson, who will be sharing why Cerec technology might just be your secret weapon for restoration success. This webinar is also sponsored by Dentsply Sirona. If there are any questions, please add them to the Q&A section, and we'll answer them at the end of the webinar. And Henry Schein is not offering CE credit for viewing or attending this presentation live or on demand. All right, Dr. Henderson, take it away.
Okay, hey, thank you, Adam, so much for hosting, and Henry Schein Dental Academy for sponsoring, along with Dentsply Sirona. Welcome, everyone. I'm super excited to share with you some tips and tricks with Cerec CAD/CAM. I don't know where we're all at in the digital workflow, but I'm hoping no matter where you're at, you're going to be able to learn a takeaway or two from this evening. We just go past the poll, Adam, or I don't see anything coming in. Is it coming in on your side?
Yep, I've got it. So I can tell you
Okay, cool.
41% have no experience with
Okay.
Cerec technology,
Okay.
22% new users, about 42% are really comfortable.
Okay.
So that's the breakdown.
Okay, super fun. Thank you so much for that
Yep.
help. All righty. I just want to share with you a little bit about where I'm from. Because I really believe that if I can do it in Clarkson, Washington, then it's possible anywhere. This is my office down here in the front center, and we have Walmart up in the corner and Costco in the other corner and the Snake River across the front there. So we're 2 hours away from an expressway. So pretty remote location, and a lot of our patients are driving 1 hour to 2 hours. So I guess, yes, they certainly appreciate Cerec, so they're not making those second visits. But again, I just feel like if it works here, it's going to work anywhere. I would never, ever go back to life before Cerec. I hope by the end you'll see why. I absolutely love the digital workflow, and Cerec has thoroughly unlocked that. Return on investment, I think that's something I just wanted to touch upon that because I feel like that's a point that, of course, doctors are concerned with when it's a large equipment purchase like Cerec and Primescan and Primemill. But I will say that when I jumped in, I have had previous to Primescan, which I use now most of the time, I still have Omnicam. And when I jumped in, our large dental insurance provider had frozen rates for 3 years, and then they went ahead and cut rates 15%. So I can no longer afford my lab bills. I had a great relationship with my lab. That was actually one of the hardest things I had to do was talk to him and let him know I was doing Cerec. But I will say that I just would never look back. I wanted to have something that was going to be as high quality as my lab, and my lab was excellent. And I really feel that I have that and more in Cerec. So in the words of Imtiaz Mange, who I just always, his words resonate in my mind a lot of times. And he said, burn the boats in the harbor. And that's what I would recommend with Cerec to get the most from it. Just jump in and never look back. The more you use your Cerec, the more you're going to love it. So get with an equipment specialist and talk more about return on investment if you need to, but I can say that it's not an issue. One thing that's also awesome is Cerec Doctors is just a great community of dentists. If you don't have the block color you need and there's a Cerec doctor across town, I guarantee you that you're going to get hooked up with the block that you need. When I went to my first Cerec meeting, and it was outside of the Learning Center, like I said, I did take all the courses at the Learning Center at the time I purchased. I really feel like the people who maybe say, oh, I tried it, I don't like it, I really wonder, did they buy it new? Did they buy it used? Did they take all the training? I mean, I just can't recommend that training experience enough. But so I go into my first Cerec meeting in Las Vegas, and at that time it was a pretty small gathering. It's not so anymore, but Right there in front of me was one of my best friends from dental school, Dr. Eric Eby. And it's so fun to share cases with each other, share wins, share learning points. Cerec Doctors, just an awesome, awesome group of individuals. I find Cerec extremely rewarding. Not only do you start with nothing and end up with a beautiful restoration, but your patient is excited about the process, your team is excited about the process. So, absolutely, that's another thing that I love about Cerec. But what were some of our objectives of the webinar tonight that we talked about is I want to share some advantages of Cerec Primescan and Cerec Primemill for enhancing our patient workflows and outcomes. I want to share some case reviews that really speak to the benefits of CAD/CAM technology, deep subgingival crown margin, full arch restorations, anterior and posterior implant restorations. I also want to talk about how I use Primescan and my 3D printer to take digital impressions and produce models and orthodontic clear aligners, as well as bite splints. Along the way, I'm going to pause and talk about staining and glazing techniques because I really feel that this is another thing that maybe doctors who haven't used Cerec think, oh, well, I don't really want to do lab work, and I don't know if I can get the same results as my lab. I want to just definitely take that issue off of the table and share with you some techniques that I use for achieving aesthetic restorations very quickly, very predictably. And ultimately, I really hope to demonstrate how digital dentistry, specifically Cerec, is just at the heart of absolutely everything that I do. So let's start with that, some of those advantages. The first of which, this is something I don't miss at all. Before I did Cerec dentistry, this was not uncommon. We would hear this from time to all too often. My tooth didn't hurt until you touched it. There's nothing good that can come from that conversation, even if you've told them ahead of time you're worried about the vitality of the tooth. Pain is just not a way to win relationships. But that is so a lot of those teeth did end up needing endodontic therapy between the preparation and the final seat. It is completely different when we're doing same day appointments. When we're sealing that tooth immediately, we just don't have that issue anymore. In fact, it's kind of the opposite. We have more of like I'll push it a little bit, like, oh, I would think maybe this tooth might need endo. Um, Definitely in the previous world, I would have done the endo prior to the crown. Now we just go ahead and we move forward with our Cerec restoration. We get that tooth immediately sealed at that single visit. And it's absolutely incredible how conservative you can be in the reduction in endodontic therapy that's needed. Obviously, I know that you can realize this if you're not using Cerec right now. You can realize, yes, I'm making temporaries and sometimes those come off and you have to refabricate them. Or maybe a patient comes for their seat appointment and they say, oh yeah, I lost my temporary a week ago or 2 weeks ago. In my case, I used to have to wait 3 weeks. My lab was 6 hours away and it took 3 weeks for a crown. So yeah, we had some mishaps along the way with provisionals. And it's just so incredible to not have to have that stress added to your day of, oh, now I have to anesthetize, pack cord, the tooth moves, I'm adjusting contacts, adjusting occlusion. You just don't have those issues with Cerec. Kind of along the same lines, that second appointment, and all those, you're resetting a room for the same patient for a non-productive procedure. So it's nice to add to the practice rather than kind of taking away from the practice from a profitability standpoint by not needing that second appointment. And it's just better care. Patients love it. We'll hear more about that later. And Biocopy. I need to talk about Biocopy because it's one of my favorite things. And there's no way that you can't accomplish this with an analog workflow. So let's just start off and learn a little bit more about what Biocopy means. Basically, it means the opportunity to take that. In this case, we were preparing tooth number 19 for a crown, and I love the surface anatomy. I love the occlusion. I'm always going to check the occlusion prior to anesthetic because I'm going to copy everything that I like and just save myself some work and get predictable results. We were replacing this crown due to recurrent caries wrapping around the margins, but I like the occlusion and I like the anatomy. So we're just going to scan, take our digital impression at the onset of the appointment, and we're going to bring this into our final restoration. So that's what biocopy is, the ability to bring what you want forward. Say this was fractured, say the distal lingual cusp was fractured away, but I like the rest of the tooth. I'm still going to use biocopy. I'm going to just not copy that fractured distal lingual cusp, but I'm going to keep everything else that I like. Here's another example of biocopy. This patient is delightful. She was actually in the office yesterday. She, at this point, was 100. She's currently 102 years old. She's blind, lives on her own, an outstanding and amazing individual. But she has had this partial for over 60 years. So I don't really sign up to do anything on this patient. She's hard to work on, sweet little thing, but she can't be laid back comfortably. The air and water is an irritant and starts her coughing. And so we just really, obviously this tooth here, most people would say, oh, you want to treat that? I really don't. But I didn't have an option. This tooth we had to treat. Tooth number 4 had caries wrapping all the way around the margins. So here she is with her 60-plus-year-old best friend, her smile. And we were able to just copy everything in this restoration that she's had to support her partial, the rest seat, the guide plane, the undercuts, all of that was transferred into this Emax restoration. So that when she left with her smile. She has her partial intact. And I just remember I don't do a lot of removable appliances, but those were not fun. Number one, you had to take those impressions with the partial in place and send the partial to the lab. The lab's going to, say, hey, this might not work. And they're going to charge you extra for that, maybe not even working. And then they're going to have that partial for a long time. So she's without all of her teeth for such a long time. So, what a great service this is with that Biocopy workflow and Cerec. Other indications for biocopy, bite splints. We do a lot of bite splints, and patients, we don't need to change out a bite splint for when we do a crown because it'll still fit. If we like everything, we're just going to biocopy it, keep the same shapes, contours. Retainers are still going to fit. Sleep appliances are still going to fit. And so those are some real benefits that I see to Cerec. This is another thing that's kind of great that you don't have with your analog workflow, predictable scheduling. You know how long the restoration is going to take in the mill because it's going to tell you that. It's going to tell you exactly how much time it's going to be in the mill, exactly how much time it's going to be in the oven. So those are the times when you go do hygiene exams or short doctor appointments, and your team can help keep you on track because they also know exactly how much time until you're ready for the next steps. So I see that as an advantage in my practice also. And you maintain control of the whole process. You don't have those frustrations of maybe my communication to the lab wasn't what I thought I was saying. You get immediate feedback, so you're going to know, oh, I could have prepped that a little bit differently for a different outcome. So you can learn a lot faster, and maybe I could have done that differently so my contacts were easier. I can see how that's affecting the restoration, or that color is not shining through like I wanted it. Maybe I want to make my prep a little bit less and pull a little bit more of that dentin through. So that immediate feedback allows you to learn on the fly really quickly. You're not relying on a lab, so you're not chasing, sending those out to the labs, working on lab slips and bringing cases back in. It just frees up a lot of time in your day and your team's day when you don't have to do that. I'm not sending emails to labs anymore with photos, and I definitely appreciate that. You will absolutely become a better clinician along the way when you see all that goes into Cerec, even though it is great software. You're going to learn things from a lab perspective that you maybe didn't think of before. And patients appreciate it. Right here, we have, I found this on Sirona's website, and 2/3 of patients would switch their dentist in order to receive a single visit dentistry treatment, whereas 50% would be willing to pay more for single visit dentistry, and 2/3 would be willing to travel further for single visit dentistry. So there's huge opportunities there. The bottom things kind of speak to how the track record, like it works. It's technology that works. And it's not going away when every 5 seconds a Cerec restoration is being placed around the world. The one thing that I absolutely love about Primescan is it is an incredible segue into an entire digital workflow. With Primescan, you can do single tooth indirect restorations, you can do bridges, you can do implants, implant restorations, you can do surgical guides, orthodontic clear aligner fabrication models, in-office bite splint fabrication. If you aren't ready to, jump into 3D printing and that just yet, I think you should. But if you're not yet wanting to do that, then you can send digital impressions to the lab of your choice. So you can get access to all of that with Cerec Primescan. So I want to talk a little bit about Primemill. Primemill met the challenge basically with the mill is you have kind of the two things that you're trying to equate. You're trying to equate speed with quality in the mill. And because obviously we're trying to respect our patients' time, our practices' time. And so the faster you can mill a restoration, then, that potentially is going to have really a strong impact on your practice and the patient's experience. But in the past, a 5-minute crown wasn't feasible. You couldn't mill a crown that had good marginal integrity, good fit in 5 minutes. So Dentsply Sirona took that challenge and looked at it as an opportunity. What if we can get speed to equal quality? And what if we can manufacture an outstanding crown chairside in 5 minutes? And so that's exactly what they did with the Primemill. So Primemill is super fast. Here's a restoration that was milled on the Primemill in 5 minutes and 2 seconds, and compared to the same restoration on the MCXL in 8 minutes and 30 seconds. So you can see both are high quality restorations, but the Primemill is definitely more refined and absolutely faster. So they achieve that through at the same time, actually making it more versatile and more convenient. So they achieve that with some algorithms, and those algorithms also make it more convenient. You can just kind of scan the block and it knows exactly what you're doing. You don't have to tell it anything. It's more versatile in that it mills many, many materials. And one of those materials is zirconia. And I myself love Emax. Almost love Emax is an understatement. It's just really I use it almost exclusively, but I know a lot of people feel that way about zirconia. So to have a mill that can do all of that, it can do zirconia as well as Emax, as well as many other materials. That's an advantage with the Primemill. So this is what the Primemill looks like, and these are kind of my takeaways. It's definitely fast. Gives high detail it has a new 0.5 millimeter tool, so that allows finer details, and it mills zirconia. So you've heard from me. Let's go ahead and hear from one of my assistants, Portia.
It allows us to give our patients a crown the exact same day without that 3-week wait. Primescan does allow us to document mid-treatment using the camera on the handpiece. And it also allows us to scan previous models, which is beneficial for implants. We can copy conditions and the occlusions into a new restoration.
Awesome. Thank you, Portia. So I want to talk about the imaging capability of Cerec Primescan. And to do that, I want to look at a deep subgingival crown margin, because this is a case I'll forever remember. Literally, when I saw this on my Cerec, I was like, oh, wow. You hear people say, oh, Cerec's not high quality. That is not my experience with Cerec at all. And I think this case demonstrates it. So here's an existing PFM, and you can see this was maybe a tough situation, because on the existing crown, there's an open margin, and we're way down here at the alveolar crest, and we're on tooth 31. And then this is what we achieved with Cerec. So obviously, beautiful marginal integrity. I don't think you could achieve better that's great on any tooth, let alone number 31, where we're right at the alveolar bone crest. So I just that is kind of forever imprinted in my mind, and it really helped me to trust Cerec, and because at first I'm just used to holding things in my hands and accomplishing dentistry really with my hands, and to turn it over to the digital workflow, it did require a little bit of trust. And so this case, I just always remember. And when we look at this case clinically, I mean, oh my goodness, I wish I could even shine more light on this, because this margin is so deep down there. And I just don't think I could have done this with PVS. And then if I managed to get an impression, then how would I have provisionalized it so that I wouldn't be fighting bleeding at the seat appointment. So just to be able to take that tooth from start to finish and have that kind of an outcome, again, that's just kind of awesome. And this speaks to the why behind that. There's a smart pixel sensor in your Cerec and in your Primescan, and it's capturing 1.5 million 3D data points per second. And the measuring depth is up to 20 millimeters. So that really speaks to the accuracy that you're able to achieve with Cerec. I definitely find it to be nothing but outstanding. And this is Catherine. Catherine is a hygienist that I work with. So let's hear what Catherine has to say, what her experience is.
So my favorite part about Cerec crowns is the relationship between the Cerec porcelain structure and the tissues. With older restorations like full gold crowns, PFMs, and even larger amalgams, those metals and the exposure to the tissues cause a lot of bleeding and inflammation. So when we have those really nice Cerec restorations, the way that they integrate with the two structures seamlessly also helps those tissues not bleed, keeps them healthy, and promotes a healthy relationship between the tooth and the gums.
I completely agree, Catherine. Thank you so much. So yeah, just excellent margins, and perfectly fitting restorations are absolutely achievable with Cerec. So we know that we can do single tooth restorations with Cerec. What about a full arch restoration with Cerec? So this patient presented, and his chief complaint was pain on his maxillary premolars, and it was significant. Honestly, it sounded pulpal, and he just wanted me to fix those two teeth, those two premolars. Well, number one, a really significant medical history for this patient, and number two, significant shoulder pain at that time, to where he really couldn't be reclined comfortably at all in the chair. I mean, definitely when they're almost sitting up and they're like, oh, that's as far as I can go. That's him. So not to mention the severe erosion that he has, and so absolutely can't just treat those two teeth. But he was persistent, and so I did agree to treat him. And so we ended up with Cerec restorations, what he had remaining, full arch of Cerec restorations. I'll walk through kind of the how that we did this, But I'll tell you right now that we did it just 2 teeth at a time because I was literally having to stand, and I don't do stand-up dentistry. I did use my saddle some too, but I'm literally like upside down trying to do his dentistry. So that brought an extra challenge. And yet we just were able to obtain really a really nice outcome with Cerec. But we did it by breaking up the appointments. And so we would prep 2 teeth per appointment. I did look back in the appointment book and saw that what we did was we had 3-hour appointments, and we spaced those 1 week apart. And so it did take us a month to do those preparations with 1 appointment per week. However, 3 hours, and he needed lots of breaks. And I was mostly standing. So even to be able to take him from start to finish like that, I felt like that's a win. So I want to walk you through how we did that. And we did this back when it was more analog. So today this would be a digital wax up and 3D printed models. However, I liked this because it's like you can do this right now, because this basically takes the workflows that you're already using likely. So we start with our actual wax up in wax and make a silicone putty matrix for that. Accomplish caries removal, do core buildups, and then Luxitemp goes in our putty matrix, and we put that Luxitemp on the teeth. So what that allows for is it allows for us to use that Biocopy feature. So this is the Luxitemp on the teeth, and now we can actually just prep 2 teeth at a time because we have these we know where we're going. He wore this Luxitemp provisional for a week with all Luxitemp before I started the preparations. Occlusion was great. Those teeth no longer hurt. He could eat normally again. So then we began copying the Luxitemp into Emax porcelain with Biocopy. So we take our digital impression and we just simply go from this material to Emax material. So his case looked like this facially. And the thing that I think is kind of extra amazing is, again, this was tough. This was upside down standing while the patient barely reclined at all. And check out these margins that we're able to obtain with Cerec. So I feel like, if you can maintain it, if you can obtain that on the really tough cases, you've got the all day, everyday stuff. We're not doing anything special for staining and glazing. We're basically treating every tooth the same, anterior, posterior. We're going through the same kind of steps with stain and glaze. So that's the next thing that I want to really talk about because he wanted things a little bit brighter than his, what is this? Probably A4. He wanted brighter. So we did A2, but then we're using some warmth to make it look a little bit more natural. So let's talk about staining and glazing, because this is actually fun. It doesn't have to be a stressful part. So quick and predictable stain and glaze. And again, my material of choice is really Emax. I love Emax. So the first thing that we ask ourselves is what block are we going to use? What block are we going to put in our mill? And so my first question is the goal to pull color through the tooth, through the restoration, or is it to block it out? Is there something that is dark in that underlying tooth structure that I don't want to see in my final restoration? Or do I like the warmth of the dentin and I want to pull that through? Almost always, my answer is I want to pull that through. I think that makes just a really beautiful, really natural restoration. So I prefer high translucency blocks. And I will say that is unusual. Most people, it's mostly taught and most people use a low translucency, or now there's even a medium translucency block. But my preference is definitely the high translucency. This is the shade guide that my assistants reach for first. And we're looking at really, this is also how it differs. I think when you go to a lot of courses, they'll teach you to kind of look at the cervical color. We're actually looking more at the incisal color because you can add cervical warmth really very readily. but you can't brighten restoration. So I like to start with that brighter color. And then if we want to, how much chroma we want to develop in that cervical area, we can do that very easily. So that's my initial consideration with the final restoration color is, am I trying to pull it through and I'm going to use high translucency, or is there something that I can't cover up that I'm going to use low translucency? So high translucency is my bias. We mill that restoration, we give it a quick try-in just so we feel super comfortable with it. And then the next thing we do is we begin a little bit removal. First, we remove the sprue attachment. I love this polisher for that. My assistants help me out and set things up with this polisher first, because if this one's on there, I'm just going to pick it up and use it and destroy it. The sprue is just sharp enough to where it kind of cuts grooves in this. So this one stays in good shape and this one stays in good shape if I just remove my sprue with this shape of polisher. And then I do a little bit of polishing and shaping with this, point. And it comes out of the mill really, really nice. There's very little that you really have to do, but I do enjoy adding just a little bit to it. I like to add a little something for my stain to kind of stick into, and you'll see that as I demonstrate staining. I had to think about my words there because I try not to use the word staining to patients. I like to just say glaze. I don't think, even if it's white, I don't think patients like to hear the word staining. So I sometimes slip up on those words. But right here, again, something that isn't as necessary anymore, but I a lot of times do like to kind of define things a little bit and just give that stain something to go into. And whether it's the CEJ, and then I can kind of pull the color up from where it kind of first sticks in that CEJ. But sometimes just a little defining between the removal of the attachment, polishing, shaping, and defining. Typically, it's anywhere from 1 and at the very most 3 minutes. It's not very much time spent. This is a big tooth. It's taking me a little bit longer, but generally that's very, very, very quick. So this is the block that I really like for my polishing, Meisinger block, and it's the Dr. Clem block. Dr. Clem is a CAD/CAM dentist in California who has developed this block for Meisinger. And so, you see the block or the polishers that I like for sprue removal, polishing, shaping, and I love this cable handpiece. For that, you want to be using low speed, very slow speed when you're polishing porcelain. So we're almost ready here to put some stain on it. The first thing we're going to do is we're going to take it to the steamer and just give it a quick cleaning. We want to remove any dust. I can recommend this steamer highly. Again, this is that Cerec community. My good friend, Dr. Eric Eby, told me about this steamer, and I had an inexpensive one that a trainer had recommended. And yeah, this one, you'll never be sorry. I would just spend, I don't know, $1,200 or something. I would just get this. You'll not have to replace it. I just wasted $300 or whatever it was on an inexpensive one. This one is fantastic. So love that. This is what you're going to do to get it ready for applying the stain. Your final step before the stain goes on is affixing it to your firing pin. The crystallization pins come in 3 sizes: small, medium, and large. And you want to choose the right size. So you want it to be not too small, but you want it to not be touching the side. So this looks perfect. And then you're going to use, my preference is Object Fix Flow, this material here. Object Fix Putty is another option. But like I said, I much prefer the flow. And you're going to fix the restoration to the crystallization pin. So after I've tried it in, I'm just going to, and steamed it, I'm going to give it a quick dry. I just use canned air. So it's just sitting at my area where I do staining and glazing. And then we're going to attach it to the crystallization pin with the Object Fix Flow. So you can see I'm going to cap that because it does dry out quickly. So just always get in the habit of just capping it quickly. And, I used to do this neater, and now I just use this micro brush. It works beautifully. And you just want to push it up and support those margins. I like just to make sure that the margin is sealed, because I don't want to have any of my glaze get onto that margin, where then it'll prevent it from bonding to the tooth. So I just want to make sure that it's well sealed. And if I do happen to get any of the object fix flow up onto the restoration itself, that just cleans away with water. But you do want to clean it with water prior to your stain. So this is what my staining area looks like. I have a computer monitor for the photos and our palette. I love this brush. These brushes are a little hard to find, but I love this brush. It has nice long bristles, so they're very flexible and very thin. And then these are the 3 shades that I work with. I've tried all the shades, I've used all the shades, but I almost always use either 2 or 3 of these. I'm always using the white, and then I'm going to vary the amount of chroma at the cervical depending on my needs. And so you're going to want to definitely use your specific to the material as far as your stains. So I'm using Emax CAD stains, and I'm using the 2, the 1, and the white. And we'll look at that a little more closely. I love spray glaze. Spray glaze just makes it beautiful and easy and super fast. So that's part of my tip with making it predictable and beautiful. So as far as the applying the stain goes, I first start with my cervical color, and I'm applying it into that just a little, I just created just a little bit more for it to hold into at the cervical when I was polishing. And then I'm going to drag the color up as I want to add any warmth. So depending on how much warmth I want to add into the tooth is how much I'm dragging it up. Sometimes I'm not dragging it up at all. Other times, like we're seeing on the centrals in this case, I'm dragging it up quite a bit. But really my thought process here is just, where is the enamel thinner and where do I want more dentin showing through? So where we have the thinner enamel is where we want a little bit more chroma. So that's going to be pulling up from the cervicals. And then I also oftentimes will apply a little bit of warmth on the occlusal table, not a lot down in the central groove anatomy, but just a little bit. I no longer apply those stains, those dark stains like mahogany. I just don't like those. I don't think patients like those. So I don't use those anymore, but the enamel is thinner there. So a lot of times I do add a little bit of that warmth just to break up that surface and have it not look fake, but have the tooth look real. Just this week, we had a patient who had ortho brackets bonded on, and he was like, they were frustrated because the bracket would not bond to that one tooth. And then they figured out, oh my goodness, that's a crown. They couldn't tell the difference. And so that is my goal every single time. I just try to trick the eye. And so I think kind of just breaking up that surface does that. And so now I'm applying white, whether it's an incisor, I'm applying it on the incisal edge and then dragging it down, or if it's a posterior tooth, I'm applying it around the occlusal table and then dragging it down. I'll drag it down further to create craze lines. I love craze lines, maybe even sometimes a little bit too much, but craze lines are like I think the biggest thing that make the tooth appear natural. And they can be extremely subtle to where, a patient would never even recognize that there was a craze line in the tooth. I think most of the time that's true anyways, but what they do is they, again, just break up that surface so that it appears very natural. You can always add porcelain. Rarely do I add to a contact. Very, very rarely. You're going to get great contacts with your proposal and your Cerec restoration. But if you want to, if you need to, it's simple. It's quick and simple. Sometimes, very frequently also, but sometimes it's fun to just add a little bit of that porcelain because it's so beautiful. It just adds a brightness maybe at the on a near cusp tip or incisal edge. So I want to go over the glazing process because it's very important. This is what's going to give it that shine and that lifelike appearance. So it's so important that you shake the can really well. So my assistant actually starts shaking the can when I start the staining process. It's going to be, 1 to 2 minutes, probably 2 minutes of shaking before we're going to use the glaze. So you shake that well, and you're going to know that you shook it well because it's going to dry down very quickly. If it doesn't dry down quickly, that's an indication that it wasn't mixed well. And it's also going to likely result in the loss of some of those details that you just put in the restoration. It kind of just flattens everything out. So you'll see that my light was kind of shaking here, and everything's a little bit wobbly because I'm literally like shaking that can as I'm waiting for it to dry down too. So between coats, I'm shaking it. I'm going to apply 2 coats. I'm going to have that can 4 inches away. And that's a little bit tricky in loops. I kind of like lift my loops up and down to see where I'm at. But 4 inches is my goal. And then you're going to apply it kind of downward or straight on. You don't want to apply it upward because, again, you don't want to get anything in that margin area. But very, very, very straightforward to apply the stain and the glaze. So I want to look at an anterior tooth because initially it's like, oh my gosh, I can't do an anterior tooth. I can't do a single central. I'm here to say you absolutely can do it. And you can do it more predictably than sending it to your laboratory. So normally I like to look at before and after pictures. But in this situation, I'm going to look at an after picture and then a before picture. So this is the implant restoration, tooth number 10. And this was done, I did this, I think it was within a month of starting with Cerec. So this is how the restoration ends up. And I mean, I know it's not perfect, but when you look in this mouth, there's a lot that's, a little less than perfect. We could do some ortho to level and align, derotate, flatten, level the occlusal planes. We didn't do that. He already had this implant, and now we're just going to place a new restoration on it, which looks like this, because this is how he presented. He presented with a fractured zirconia restoration. So this was previously, and this was that restoration previously. So this is a lab restoration. And, even though I feel like, my restoration, I can, maybe do better on that. But this is what he had from the laboratory. And I do think that this does look better. And I just love the emergence profile. We'll talk more about that because I love the emergence profile that we get with Cerec implant restoration. So yes, you can absolutely do it. Anterior, posterior, it doesn't matter. You're totally set to go with staining and glazing. So let's look a little bit more about implant restorations and the CAD/CAM workflow with that, because it is absolutely one of my favorite uses of CAD/CAM for this first reason right here. I couldn't wait to tell you about this one, emergence profile and soft tissue health that results from that emergence profile. These are our Cerec implant blocks. So the hole is for our screw access opening. These can be a single abutment and crown all in one, which would use this block. Or you can do it more of the traditional way of the abutment, and then you would just mill the separate crown to go on that milled abutment. But my preference is 100% screw retained. I used to avoid screw retained for the aesthetics. A lot of times, at best it would look like maybe an endo tooth with a PFM and not nice endo access through the top of it when we did screw retained restorations for implants. That is not the case with Cerec. And so I'm excited to show you that. There's no lab bill. That's pretty fun. No lab bill. Very quick turnaround time. That case you saw before. Again, I'm pretty sure it was my very first implant restoration on Cerec. And I looked back in the appointment book, and that was a 3-hour appointment start to finish. So that's very quick for a patient. And surgeries are guided with information from our cone beam. And so that is what allows the restorations to be screw retained and what allows that quick turnaround. There's a wide range of implants that are available with Cerec. I have my favorites, but you don't always get to choose what's walking in your door. So there are a lot of options that way that I'll share with you. So my favorite thing is that emergence profile. That is using this tool called Gingiva Mask. So when we click on Gingiva Mask, what that allows us to do is to copy the soft tissue around that implant. So that copy of this line is, I'm telling it, okay, look at everything inside of this and make my restoration fit that perfectly. And so that's what it does. It's not too tight. It doesn't leave it unsupported. It supports the tissue perfectly. The restoration goes into place. And that is copied exactly into your final restoration. So these are a couple of Cerec hybrid abutment crowns, screw retained, and that gingival mask is allowing this information that I used to try to send to the lab in the analog workflow, but it was extremely tedious and time consuming to do so. I no longer do that. We just take a super fast scan and that information is there for us. And then Cerec takes care of the rest. Using those screw retained restorations now, this is an example. This is a screw retained, what we call hybrid abutment crown in Cerec language. And you can see this blends beautifully. The Tetric Evo Ceramic material is designed to work with your block. So if you use an A2 block, you're going to use A2 Evo Ceramic. That restoration just seats into place very easily, and you're going to fill that screw access with Evo Ceram, and you're not going to see which tooth is the implant. This is an example. And so, like I said, I love Cerec. I do absolutely everything I possibly can with Cerec, and especially implants. And this is part of the reason why. There are a few things you can't do with Cerec. So that really small, 2.9 Straumann anterior restoration, you can't do Cerec with that. So this is an example of a lab slip. And this was just one of the patients that came to mind. This is from 2020. So you're looking at this expense, and this isn't including an implant analog because I sent that with the case to defer that cost. So I don't have the analog incurred in mine as well. I went away from pouring models when I restore with when I restore with Cerec in general, but when I restore with implants, and now I've come back to it, I just like it. And so I didn't include, so I do use an analog, and I'll show how I do that. However, I didn't include it here because I didn't include it here. But this is the list price of what it costs to give a patient a beautiful implant restoration very efficiently. So significant difference between those numbers. I talked about surgeries are guided with information from cone beam. This allows it to be that more efficient process. We know the adjacent contacts, so we can make our restoration draw with that, and that can keep it screw retained. That way we can plan our access opening for that screw. We can plan, obviously we're looking at anatomy, inferior alveolar nerve, quantity and quality of bone, but the guided surgery is another thing I wouldn't go away from. And so I talked about how there's a lot of opportunities for different implant manufacturers and implant systems to be restored with Cerec. This is actually this piece is called a tie base. I don't think I actually introduced that. A tie base is what you then bond your Cerec block onto. And then this whole thing gets screwed into your implant as your final restoration. So these are the various manufacturers. Straumann makes their own now. And so now they have something called VarioBase. So instead of the tie base from Sirona, you can use the Straumann VarioBase and seat your block. And you want to do that with Straumann because then they warranty the implant. But there's even more here than it looks like because, for example, the oral surgeons in my area, they use Legacy implants, and Legacy is compatible with Zimmer. So even though this is a long list, it's actually even more than that that Cerec is compatible with. Just quick, this isn't really critical, but I just want to show this because of my love of that emergence profile that you can get with Cerec. So this is a bone level implant, which is my preference. I love to have this running room from the bone to the occlusal to just support tissue, maintain that gorgeous tissue around the implant. These short and squatty ones that you get with tissue level, while it's still completely achievable, these aren't as aesthetic. You're always going to see a little bit of a dark area in that access, where the tie base is, where that metal the metal is in that attachment we were just looking at. Bone level implants, because they're deeper, you have a little bit more space on the occlusal. And so that allows for it to just disappear. So that's an example of that. Like I said, I've gone back to liking to pour this model. I just like to have it to idealize my contours while I'm polishing, and just feel my contacts before, because the patient's not here when I'm doing this anymore. We usually have them. Now what we do is we just image in the morning and usually bring the patient back in the afternoon and see the restorations. So I pour this model as the restoration is milling and using it as I'm polishing. And then our normal steps with staining and glazing. And then we're going to bond that tie base piece or vario base piece to our porcelain, in my case, to our Emax. So this is a case that we sat this week. It's in a mirror. So number 19, number 31. And, just really pretty seamless. And that's just what you can expect to see. This goes over how you affix the tie base to your porcelain, your Emax porcelain. And simply all I do is I just follow these instructions, the multi-link hybrid abutment cement instructions from Emax. And then here's your restoration ready to be delivered. So I really want to just focus on Primescan, because Primescan is absolutely the digital, this absolute center of my digital workflow. I designed my office. This is my new office. We moved in the fall of 2017. And this is my little staining, glazing area. So really, I designed this entire footprint with the digital workflow in mind. And that's part of what makes it so efficient. In my old office, I had my mill in one location and my glazing area in another. It's just basically wherever I had counter space, and that was away from my patient area. Here, we're just a step away from the patient operatory. Here's my mill. And then here's the glazing area. I have my steamer here and my 3D printer here. Do my polishing, shaping here. My oven, my Cerec oven is here. And my staining and glazing area is here. This is my private office. So I'm just literally like steps from anywhere. These are my where hygiene is. So if I need to do a hygiene exam, I'm right there for that. If I have a few moments to go, read radiographs or work on referral communication, I'm just right there. So I love our new space, and especially because of that digital workflow. So Primescan is how we capture everything for the digital workflow, whether that's to communicate with our cone beam, whether that information goes to the mill like we've been talking about, whether that is a full art scan that's going to go to our exocad software for bite splint design that's then going to be printed on our 3D printer. Or maybe it's just going to go, maybe it's just going to go straight to our 3D printer. And we're going to print models, study models, or we're going to print models to make whitening trays. Whatever that looks like, that all starts with Primescan. Primescan is definitely the center of everything. So again, this was this week, just some of the digital dentistry that we have. Bite splints are among my favorite thing, because we've done bite splints for years, but you've never done a more predictable bite splint than what we get now. It's absolutely incredible. So it's really fun. It's very comfortable for patients, and it just makes it fun to deliver such a high quality bite splint. So I want to have Logan share her thoughts on Primescan. This is my assistant, Logan.
Primescan also allows us to gather all of the details inside your mouth, including all of the soft tissue. And the best part is that all of our patients love it. We don't even have to ask them if they would rather have an alginate. It's always Primescan.
Awesome. Thank you, Logan. That's well said. Awesome. Well, thank you everyone for hanging in there with me. And I know it was fast. There's a lot to share with Cerec, and like I said, it's something I'm super passionate about. So I appreciate that opportunity. How are we looking? Do we have any questions, Adam? Or
We do. We've only got one question so far. We've got a couple minutes left. So if anyone does have a question, feel free to drop in the Q&A or chat. The question is about iTero specifically. I have an iTero. Can I use that instead of a Primescan? I'm assuming the question is, if I don't have a Primescan, but I have a Primemill, can I interchange?
I wish I knew the answer to that. I just, jumped into Cerec, and so that is my workflow. So I'm sorry I don't have that answer.
All right. Got a couple more minutes again. Anyone has any questions? Otherwise, we'll wrap up. I'm not good at stalling, so I'm not gonna stall. I had to stall the other night. We got questions. Okay, here's one. How much? So the question is, how much does it cost for a 3D printer? I guess it depends on the model.
Yeah. Okay, I can talk about that a little bit because I would say, really, do your homework. I'm on my third 3D printer. And so I will say I was hesitant at first to just jump in so big, so I didn't spend as much money. And my first ones were, I don't even know, where's my husband? He's better at this, maybe around $3,000. Because I was like, I don't know how this is going to work. And labs were telling me that, results were inconsistent, but they were also blaming my Cerec on that inconsistency. That's another reason why I love having control over it. No, it's not my Cerec. It was actually their protocols and their 3D printers. So I have upped my 3D printer significantly. I love my Envision Tech. It is top of the line, but it is a $10,000 investment at the level that I do 3D printing now. But it's entirely different and way less frustrating than when I was kind of dabbling in it before and not feeling secure in the process. Now we're like 100% secure in the process. It's kind of like get out of our way because it can be done and it can be done extremely well when you do have the right equipment.
Excellent. Well, we've got 4 more questions now. So thank you everyone for coming through. I appreciate it. We'll knock out the quick ones first. Do you use a Speedfire?
I do not use Speedfire primarily because I don't love zirconia. I know I'm probably the minority of that, but I just love Emax so much. And I love occlusion so much. So I try not to overbuild things in terms of like using too strong of a material. So I do not use Speedfire.
Or let's see, if Cerec crown has light contact, how long does that usually take to fix?
If I want to add porcelain to a contact, 15 minutes. But it's so like after again, once you get to the point where you're really trusting your Cerec software, you're not gonna have that issue. That issue is more of when patients are in provisionals and waiting for a laboratory restoration. Thank you though for that question.
So this, I think, is kind of a neat question that a lot of people don't usually ask, but it's asked sometimes. How much do your assistants do versus how much do you actually do?
Yeah. So I actually do the bulk of the process, but I think it's very much achievable to train your team, especially the staining and glazing part. And I think that's the part that they'll be excited to learn. But truthfully, I'm not really it's not like it really would free up a lot of my time the way that I do dentistry, because it's not like I'm sitting around waiting for the oven or waiting for the different steps. I'm doing other things. I'm doing exams. And it doesn't take very long to do those steps. So right now I do the design. I do the staining and glazing.
Do you do the scanning as well, or do your assistants do that?
Both. They're very proficient in the full arch scanning. So they're usually doing all of that for like bite splints, orthodontic therapy. Is primarily done by my team. And then because I don't really feel like it's adding, I mean, I'm right there. I've just anesthetized. It's going to take, I mean, that's the one thing. Primescan just loves to image. So it's so fast that it would take me too much time to just like take my gloves off and go, I can't go do something fast enough and get back. So I'm actually doing the scanning on restorative cases.
How much time do you schedule for prep and seat Cerec?
What did I got? 2 hours? Yeah. 2 hours is pretty typical for a single unit. I mean, premolars are faster, uh, molars maybe a couple minutes longer, but 2 hours.
All right. And then how much do your auxiliaries do with the procedure?
Um, Gosh, I guess I feel like they're like with me for everything. They're educating the patient, but as far as like the specific hands-on, as far as staining, glazing, they're not doing that currently. But I think it's achievable.
All right. I know you mentioned C docs, I believe, or Cerec doctors at the beginning. There's a question. Did you do all of your Cerec training in your office, or did you go somewhere for training?
Okay, yeah. I actually did just the initial training in my office, and then all of the real growth happened at the Scottsdale Center, where I took all of the courses when I first got my Cerec. I just wanted to maximize the investment. I wanted to not be like, oh, I don't feel comfortable doing a bridge. So I went ahead, I took all the courses and loved it.
Is Cerec still cutting in 3 axes?
Cerec still cutting in 3 axes. Yes.
All right. Let's see. We started training election. It was less than okay. That was just cool. I think we got through all the. Let's see. Can you milk multiple single units at once?
You mill multiple single units at once?
Oh,
No,
yes.
you mill one restoration per mill. Some people have, several mills. So, but it's one restoration.
Perfect. All right. No more questions. We're over time. We got there. Thank you, everyone, for all the questions. Thank you, Dr. Henderson, for your time. Excellent presentation.
Thank you.
We did record the webinar tonight. So we'll shoot that out to everyone in the next week or so. We're not going to hand out the presentation, but we will send out the recording. If you do want to attend any future webinars, please visit henryscheindental.com/webinars for our upcoming schedule. And of course, please feel free to reach out to Dr. Henderson directly if you have any questions.
Absolutely. Thank you, Adam. Thank you, everyone, for your time this evening.
Absolutely. Have a great night, everyone.